Welcome back to Preserve Health Talks. I'm Dr. Ira Pearlstine, your host. And today I want to talk to you a little bit alone. I have no guests for this show. I have no co-hosts for this show. But I want to talk to both patients, future patients, listeners, and other physicians about why I went into concierge medicine and the power of listening. Because listening to people may be one of the most important things you can do as a practicing physician. When I was a medical student 40 plus years ago, I was taught that the two most important tools of medicine were the history and the physical examination. And that's true. But the longer I've practiced, the more I've realized listening is what makes medicine human. Listening is not just how we gather facts. Listening is how we honor the person in front of us. Too often in medicine, we reduce people just to their conditions. We say the gallbladder in room 7, the pneumonia in room 12, the heart failure in ER Bay 3, but they're patients and not just diagnoses. You see, the man in ER Bay 3 wasn't just the congestive heart failure. His name is Jonathan Smith. He's a retired singer who once filled great concert halls with his voice. And now he struggled to get out a sentence because of shortness of breath. His disease wasn't just fluid overload. It was the heartbreak of losing the very thing that gave his life meaning. So when you call him the CHF, you miss that. When you call him Jonathan Smith, you get that. An attending physician was rounding one morning with her team at Mass General Hospital in the 1970s. And she had her entourage with her, the residents, the interns, and the medical students that were trailing behind. And she asked her intern, "Tell me about the patient in room 407. What's interesting about her?" The intern replied, "Nothing. She's just an elderly woman. She came in not eating, not drinking, what we call failure to thrive. She was dehydrated. We rehydrated her and she's ready for discharge." The attending asked again, "But what's interesting about her?" And the intern hesitated. "Honestly, nothing really." The attending stopped and said to the team, "But everyone has an interesting story if you just take a little time to listen." So she walked into the room, sat gently on the bed with the patient, and noticed that the woman's arm was slightly irregular, as if it had once been fractured. "Tell me about your arm," she asked. The elderly woman smiled softly. "Oh, that happened when I was just 5 years old." "How?" the attending asked. "A steamer trunk fell on it," the elderly lady said. The attending leans in. "How does a steamer trunk fall on the arm of a child?" And the woman replied, "Well, it happened when our ship struck the iceberg. There was no time for medical attention because the ship was sinking. You see, I was on the Titanic." That's why I tell you, when you put your stethoscope on your patient's chest, you're not just listening for heart murmurs or abnormal breath sounds or crackles. When you're that close, you're hearing more than just heart sounds. You're hearing fear, you're hearing resilience, you're hearing the echo of a lifetime. And sometimes all it takes is one extra question to unlock that story. A question as simple as, "What matters to you most right now?" And that question shifts everything. It takes you from treating a diagnosis to treating a human being. William Osler, famous physician, father of modern medicine, said that the good physician treats the disease, but the great physician treats the patient who has the disease. Florence Nightingale wrote, "The most important practical lesson that can be given to nurses is to teach them what to observe." And physician and writer Rachel Naomi Remen reminds us that listening is the oldest and perhaps the most powerful tool of healing. Because when we listen, we offer our patients an opportunity to be whole. When we listen, not just with our ears, but with our presence, we give our patients not only medical care, but we give them dignity. Now let me turn this around, because listening isn't only a gift to our patients, it's a gift to us as physicians. And too often, those of you who practice regular medicine, I have the luxury of just seeing a few people a day, but I know that many of you as physicians are seeing 30 plus people a day, and you're buried under quotas and relative value units and prior authorizations and just an endless amount of charting. It can feel like medicine has become about numbers instead of people, which is the perfect recipe for physician burnout. But here's the truth. Numbers don't feed your soul. Stories do. When you pause long enough to know even one small detail about a patient, the teacher who coached basketball for 40 years, the grandmother who still bakes challah every Friday afternoon, the veteran who secretly writes poetry, you reconnect with the why of medicine. And that moment of human connection, it doesn't just help the patient heal, it helps you heal from the weight of the work that you're doing. It will bring joy back into your practice, and it turns the grind into meaning. Getting to know your patients, even briefly, is not wasted time. It's what will keep you from seeing medicine as only charts and check boxes. So my challenge to you is this. The next time as a doctor that you walk into a room, don't just see a diagnosis, see a story. Ask just one more question. Take one extra moment. Listen not just for the symptoms, but listen for the soul. Because medicine is not just about treating disease. It's about treating people who just happen to have that disease. A chart can tell you a diagnosis. A lab test can give you a number. But only listening, truly listening, will tell you who your patient really is. And when you listen that way, you'll discover something rather remarkable, that the stethoscope doesn't let you just hear heart sounds. It lets you hear humanity. And in hearing humanity, you not only give your patients life, you give yourself back the joy of practicing medicine. Thank you. This is Dr. Ira Pearlstine. This has been another episode of Preserve Health Talks.